This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Good morning and welcome. It's another edition of Health Watch here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here. As always, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey, and I'm your host, John DeMasi. We are ready to talk to you. We are ready to get you healthy.
I hope, John. I hope.
For the next hour.
And we're starting with each other.
That's
we just
right.
had a wonderful talk earlier, right?
That's right. Hey, we got to start where it counts, right?
That's right.
Because if you and I aren't here, we have no show.
That's exactly right, John.
855-839-1210 is the number here in the studio. 855-839-1210. If you have a medical question or a health question or any question for Dr. Molly, or if you have a medical challenge you want to run by her, that's the number to call at any time during the course of the program, 855-839-1210. It is Health Watch every Sunday, 8 till 9, here on Talk Radio 1210, WPHT. So let's start where we always start. What do you do? What do you do at Innovative Medical?
Well, John, let's start with the fact that we are a collaborating group of healthcare providers. We work out of a primary care facility in Marlton, New Jersey. And we can do anything your normal primary care physician could do. So the medical doctors, if you need a prescription, they can write a prescription. If you really are on medication and you want somebody to help you review your medication, of course we can do that as well. So if you need an antibiotic, you can get an antibiotic. But it's our philosophy that really separates us from what other primary care physicians or facilities do, in that we believe we can help reduce side effects both from the condition and from the pharmaceuticals that you might have to take from that condition by augmenting that with natural substances.
So in other words, the natural substances replace or attempt to replace
or work in conjunction with the pharmaceuticals, maybe at a lesser dose. So yes, the short answer is yes, that's what we try to do, thereby eliminating some of your symptomatology that may not be from the disease or the condition itself, but from the pharmaceuticals.
I always ask you, does this work? I'll ask you in a different way.
Okay.
This system of nutraceuticals versus pharmaceuticals, what has the success rate been?
You know what I want to say, John? I don't want to think of it as adversarial.
Yes.
Versus.
Right.
I want to think of it as working together and in harmony together. So when we do something like that, there is a good chance, depending on where you are in your disease continuum. Now, let's be honest. You can't come in with 4-stage cancer and expect that vitamin C is going to cure the cancer. It isn't going to do that. But even then, it may help eliminate some of the side effects from some of the chemo drugs you're taking. So the question is, how do you ascertain what to do for a patient in that case? Well, we believe bringing in the natural substances definitely can help a patient improve their quality of life.
Besides vitamin C, what is the, number one nutraceutical that you use?
That is so hard because we use so many varied nutraceuticals depending on what it is we're trying to accomplish. I mean, we have a full list of antioxidants. We have a full list of anti-inflammatories. We have a full list of immune modulators, hormonal modulators that are natural. So there are so many ways we can approach a problem. But I think the consistent thing is we get to the therapeutic doses, and we do that by the hydration.
I ask that question because people are probably thinking now, well, I can get a lot of that stuff at the health food
Right.
store.
Yeah, you can.
You can, but there's a downside to that. Talk about that.
Absolutely. It's got to go through your digestive tract. You lose somewhere between 30 and 50%, maybe even more in the digestive tract, because most people who come into our facility, already have problems in the digestive tract. So they're definitely not getting enough to get to the therapeutic level, whatever that is for them. And again, I don't say that it has to be a higher level. It has to be a level that works synergistically with some other things. So it takes time. And what I'm saying is the best and most direct way to get your nutraceuticals are through the hydration.
A lot of people come to you with a variety of problems.
Correct.
And talk about the initial consultation and what that does and how that helps people, and maybe elaborate on that.
Sure. The initial consultation is absolutely free. I want them to come in, bring any records they have that they think are relevant, bring anything they're taking in terms of the natural and or a list of the pharmaceuticals. We want to look at all that. And at that point, we can sit down and say, okay, we think we have a hydration protocol that may be able to help you improve your quality of life. And again, we're not curing anything. We want to help people just have some type of quality, whatever that is for the person. And we want to then get them through whatever the conventional treatment is in many cases that they've been fearful to do, or they just don't want to continue because of the side effects of the conventional treatment, whether it's oral or IV or whatever. So we're able to help people manage that and actually give them a quality of life.
How many treatments?
Loaded question. We start to see results in as little as 5 weeks, and we might have to take 30 weeks. It really depends on when you come in your continuum of the problem and what it is we want to accomplish. Obviously, when somebody comes in with MS, like my medical director did, she affectionately calls this her lifer. She said this is her health cheers. You know how they went to Cheers?
Yes.
She said, the reason why I'm here is because I know that this works if given enough time and also enough of the particular constituents that tend to work with her MS. And she will not let her reserve go down. She's vehement about once a week.
And then there are your lifers like me.
Oh, yeah. You know what, John? I'm a lifer. That's why I'm here. This is how I got into this. I am a lifer because I know it makes a difference. And believe me, when I don't do my particular protocol that enhances my quality of life, believe me, I felt it. This week I've been running ragged, as you know.
Yes.
So I was so concerned. I told the gals, listen, don't mix me up today. You guys are too busy. Well, catch me on Monday. But even a couple of days off, I start to feel it. That's why I took off on Friday, and I try not to. But the honest to goodness, because remember, there's a certain amount of responsibility that the patient has to take too. This isn't holy water. You don't just throw it on somebody and everything is beautiful. No, but if you get the proper rest, if you hold down your lifestyle, you don't drink too much, you don't eat the wrong foods, this kind of thing, and we help you with all of that, then you will improve your quality of life.
So you suggest that people come in for the hydration, but they also do something at home.
Of course, we have to look at lifestyle. I say this over and over again. Nothing says that better than people who have cardiac disease. They know that if you change your lifestyle, you get a plus on your side of the ledger. In other words, you can live longer. Can you imagine the plus you would get if you do our cardiac enhancement treatment?
Yeah.
They do exceedingly well. We have seen a difference in our cardiac patients that'd knock your socks off.
We should mention that you have over 600 protocols.
Yes, 600 variations of some set protocols that belong to us.
And so likely that there's something for you.
Of course.
With regards to your condition.
Yeah, again, we're medical hydration, and that's how we want to be portrayed. We are in a spa. You're not going to come in and just get something to enhance your beauty. But we have that, but, and we like to throw that in so you not only look good, but you feel good, right? The idea is, as Linda says, it's better to look good sometimes than feel good. I said, Linda, I have to take exception to that rule. And she said, we try to do both, and that's true.
Okay, we are coming up on our first break of the morning. The show is Health Watch, and we are here every Sunday from 8 till 9, the live version here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. 855-839-1210 is the number. 855-839-1210. That's our number here in the studio. And I always tell you at this time of the show, call early so you don't get shut out. And every week we have a couple of people who get shut out because they called at 8:58. So call early and make sure you get in. 855-839-1210. We are coming back. Both Dr. Molly and I are coming back with more Health Watch after these words. Operators are standing by right now at Innovative Medical Associates, as they are when we are here on the radio. 856-489-0505 is the number. That's 856-489-0505. When you call, you've heard us make reference so far this morning about the initial consultation, and that is complimentary, of course, and that's where you'll really learn a lot about your condition and how Dr. Molly can help you. So you want to call and schedule that. 856-489-0505. And again, the website for Innovative Medical Associates, it's innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. Our show is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. We are going to talk about MAST cells.
Yeah, mast cells and mast cells activation syndrome. Now, John, you just mentioned to me earlier in the show that you had a conversation with one of my patients' moms, right?
Yes.
And by the way, he's an adult man. I don't want people to think we're treating kids,
yes.
Right? But his mom brings he and his sister in, and they're both adult children of this family. And he has something like post-Lyme. That was the original reason why she brought him in. But in treating him, the doc and I have been talking about him, and we believe he also has a problem with his mast cells. That's why I'm bringing it up. And, you know, the mast cells in our body, they have a process. They get messages, right? And these messages can trigger a reaction. And in the science world, we call that inflammatory mediation. So when you think of mast cells as little balloons in the body, the little balloons contain a bunch of chemicals, okay, a bunch of chemicals. So when these chemicals are released, and they include something called histamine, which everybody knows about, they're thinking they're having an allergic reaction, yes, right, to the histamine. But it also includes serotonin, superoxide, heparin, various other kinds of chemicals that are involved in clotting and vascularization. So the thing about this is, why were these mast cells triggered inside the body? Why were they? Could the post-Lyme viruses do that? The answer to that is yes, it could be. So does he have a combination challenge? I would say yes. He also has this mast cell reaction. Now, what comes first? The post-Lyme or the mast cells? Well, I'm not sure. He could have had some other triggers like mold and environmental toxin. People who have mast cell syndrome tend to react very, very severely to the environment, the outside environment. It's not just what we ingest, it's the outside environment.
Wow, that's interesting.
It's very interesting. And so the first thing we did was we took the history, Doc and I, and we sat down and I said to Doc, what do you think about this? We know that he had a positive Lyme test, so we know he may have the viruses with Lyme. So with the first course of treatment, in my mind, was to take care of the Lyme. And I think we did that pretty well. But I said to Doc, I think we ought to run a mold test. And she said, okay. I said, let's run the mold test. Well, lo and behold, he had a specific type of mold that isn't usually found in New Jersey. And I find out that he lives in Staten Island most times. So
okay.
It was interesting because we were like scratching our heads, you know. But this is interesting because now you can see his plan B in the process of this has to be looking at the mast cell activation and the harm that's doing. And by that I mean it isn't just a response to the viruses. We may be able to control those, but we have to really look at the conditions that he's purporting about, including his brain fog again. In other words, we got him to a point where we had him pretty well controlled. Why wasn't it working? Why wasn't it working and working quick enough? Well, we believe that has to do with the mast cells.
This is a multitude of problems.
Yes.
And like you said, what do you attack first?
Well, in this case, we realized we had to attack the post-Lyme, but we also need to go after the various symptomatology that really is causing the inflammation in other areas. It's not just one or the other. They're two sides of the same coin, in other words. It can be very involved. And interestingly enough, I'm going to tell you, his mother, as far as I'm concerned, is an expert in mast cell. Because she kept saying, I believe my son has mast cell activation. And every doctor said, oh, well,
it's in your head,
It's
right?
in your head, right?
Yeah.
It's in her head, not his, in her head. But I think she may be right. And there are ways for us to look at this. One of the ways is to test the cytokines, something I like to do, that show some inflammation in certain areas that could point us in the direction of mast cell. There are other things we would look for. We also might look at something called trypase, which is an endothelial activation. It's a connective, it's an inflammatory reaction that can cause bleeding, etc., and that's something we can test for. We can also test for histamine, which we're going to talk about a little later. But it's an interesting thing because we also want to look at things like renin levels, which you know about from your kidney problems.
Yes.
Anyway, so there are things we can look at and then help put the puzzle piece together. And that's really where we're at with this young man. So let's look at this. This we found in the first 16 weeks of his treatment. Do you follow what I'm saying?
Yes.
So he wasn't one of these guys that could come in and five treatments be okay. He started to get better. He started to have more of a quality of life, but then we knew there was an underlying problem.
So let me get this straight now.
It's hard. It's hard, and I'm trying to simplify this.
Yeah, he's got this problem. So 16 weeks,
right?
And he feels better, but now you've got other problems,
right?
You're attacked.
What I'm saying, and this again is a post-Lyme syndrome, I would say that's the first most important thing. And did that activate the mast cells to go into overproduction? I think that could have, but now we have to address that, you see. So it's a two-part process, and it is not an easy process. Now, there are physicians who specialize only in mast cell activation syndrome. And I will tell you, one of my other patients, we like to call this POTS. She has so many of the symptoms from the mast cells that I want her to go out and have some specialized nerve testing, and I'm sending her to another specialist who can do that and then come back because I need to change up her protocol. She's a young woman, very high-powered gal, executive in HR, and she's really suffering from this syndrome that is a result of mast cell activation.
And all of this, does it start with Lyme or does
No,
it?
it can start with other things. It can start with environmental toxins. That's my point. In other words, it could be mold, it could be vapors, it could be chemicals. I've read the literature that it can start for some people with just chemicals they put on their body. That started it. So again, with the mast cell production, it's not, for example, you think you have an allergy, right, to something, and you may. That's the histamine response, which is part of the mast cell. It's one of the chemicals it releases, but it's not the only one. It's the others that can cause problems. But what we have to look at is the outside environment. That's why environmental medicine is so complex.
So
I know.
How can you pinpoint the environment and what specifically would cause something like this?
You call in and see what is going on. If you suspect that it's a mold environment, like there's water, and you have wet walls, guess what? Chances are you have mold, right?
Yes,
I mean, right?
yes.
That's what you have to do. So you have to do a little sleuthing with the patient and say, okay, tell me a little bit about what's going on. He told me that he had new carpets put in his apartment in Staten Island. Well, Staten Island, by the way, is surrounded by water. So what the heck is underneath? Why did the landlord have to put in new carpets? Was it wet? You see?
Yes.
So maybe it's the vapors from the carpets itself, or maybe it's mold. So you've got environmentalists. We need to call in an environmental engineer and test the mold, which we have one, who does a really good job. We know which mold testing really works. So there are many things we have to do. It isn't just one, John.
Boy, does this become more complicated as you're telling us the story?
Yeah, it can be.
Now we've got an environmental engineer.
Well, because it's true. Because the mast cell activation is simply more complex than just an allergy reaction from the histamine. So, and we're going to talk about the differences, because many times people think they're just having a histamine reaction, and really it's much more complicated than that.
Yeah, it sure is.
I wish, I'm trying my best. Histamine intolerance is different, and I want to say that. And one of the ways I talk about that is, of course, we talk about the mast cells being the balloons that dysregulate and break open all these things. Histamine is one thing, For example, I have a lot of patients who make homemade wine, John.
Yes.
Why do we love it so much? It has no sulfates. It has nothing that might give us an allergic reaction unless we're allergic to the grapes itself. Right?
Yes.
So, and when you go to Italy, you drink a whole lot of homemade wine, right? And you can drink more of it sometimes without an allergic reaction, because you're not having the histamine response, which is only one of those particular substances.
Talk about the immune system.
That's where you got to go.
Is that impaired in all of this?
Of course it is. So how do we treat that? We treat it with hydration therapy. One of the ways we need to do this is, we know that we need to look at this in terms of the vitamin C, which we know is a great immune antioxidant. We have to look at vitamin D levels. We have to look at their B vitamins in terms of methylation, because they may have a genetic dysregulation. So that means they need a particular type of B vitamin in their bag. So also need to look at things like beta glucan to enhance their own immune system without turning it on to overdrive, right? This is an overdrive issue. So again, it's a little complex, but it can be resolved utilizing natural substances. And also, by the way, we all know that if you have a histamine intolerance, what do? You take an antihistamine.
Yes.
Right?
Now, we've all heard of that. Yes.
Of course. But here's the thing, in a healthy body, meaning we can handle most histamines when they're thrown at us. In other words, we have this histamine response a lot. That's a good, healthy body immune system. But it's when their body can't get rid of the histamine, therein lies the problem. Think of it as a clogged drain. It gets out of your body too slow. That's when the histamine gives you the problem. Hence the antihistamine. Okay, does that make sense? It's
sure
like pouring liquid plumber down there, and what you're doing is you're actually giving you the remedy to too much histamine that was overflowing in our bodies.
And with that, we're going to break for the halfway point of the show.
I know.
as you're on a roll here, but we'll pick that up after the break. It's Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. 855-839-1210 is the number here in the studio. If you have a question for Dr. Molly or a medical challenge you want to run by her, 855-839-1210. That's 855-839-1210. with Dr. Molly Fantasia. Again, I'm John DeMasi. We are both returning with more Health Watch after these words. And we are back here on Health Watch. Operators standing by right now at Innovative Medical Associates, and you want to contact them, 856-489-0505. Again, that's 856-489-0505. That's the number for Innovative Medical Associates. And as I said earlier, if you call and you want to schedule that initial consultation with Dr. Molly, because that's really where you can get a lot of the information that you need in order for you to make a decision whether to move forward or not. And that's really important in your overall health picture. 856-489-0505. That's the number, Innovative Medical Associates, Marlton, New Jersey. And the website, innovativemedicalassociates.com. I suggest you go on that because there is a lot of good information on that as well. Innovativemedicalassociates.com is the website. The show is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. And we were discussing
mast
cells. So you're going to wrap this up.
I am, John, but I want to tell people. So you have to think. Some of my notes on this are that in mast cell syndrome, the symptoms are more diverse than just with histamine intolerance. That's number one. So the symptoms can include the brain fog, the shaking, the trembling, the muscle weakness, all sorts of cardiac conditions, and also blood pressure drops, random blood pressure drops, and rises unpredictably and causes passing out. So that's why I say this woman has POTS, P-O-T-S. She's not crazy, trust me. I believe she has this. And here's the thing. Your mast cells release these different chemicals, and there are a lot of them. So you may have a normal amount of mast cells. That's why just testing for the mast cells themselves doesn't tell you you have mast cell syndrome. You've got to look at the symptomatology, okay? Because you may have the normal number of mast cells, but they act abnormally because why? Your immune system is screwed up. The idea is we got to get you back to what? Homeostasis, right. Okay? So what we want to do, now you may also have a large number of them that act abnormally, but again, testing just for the mast cells may not do it. So one of the things you need to do, you can repurpose some drugs for that. We use LDN for some of this. We use Zantac also, which is repurposed for that. And the other things is you want to do a low histamine diet. Why? Because you don't want to trigger the histamine intolerance, right? By having so much histamine, that also gives a signal to the mast cells to go into overdrive possibly, right? The one chemical. So we want to make sure that you don't get that unsafe buildup of the histamine, which causes the allergic reactions, which then in turn could, activate your mast cell. So we want to look at all these things. So again, mast cells can be triggered from outside influences that are environmental in nature. Usually histamine reactions are usually around things we put on the body or we ingest, like I talk about the sulfites in wine. So we want to look at this. But I think the takeaway is what? We want to take away by remembering that if we bring our immune system up with hydration, including vitamin C, including D vitamin, including things like the beta-glucan, including quercetin, which I talk about, including the use of LDN, we may be able to re-regulate this, and you may not have any of this, whether it's a histamine reaction and or the mast cell reaction, which is infinitely worse.
All right, 855-839-1210 is our number here in the studio, 855-839-1210. We often like to talk about patients and the conditions, and it really helps you to understand how Dr. Molly can help many people with a variety of conditions. And we've got a list of patients to talk about today.
Well, we talked about the one young man,
yes,
and that is a true case, and we're still working on him, but he is definitely having improvement.
Where do we start here? The patient with scleroderma?
Another autoimmune disorder. if you think about this, she has scleroderma, and she said she was definitely tested and definitely has scleroderma. She's being treated by a very well-known institution, and there's not much that they claim they're doing for her at this point. So again, this is an autoimmune disease that affects the collagen, right, in the body. So what we want to do is, yes, we want to give her some things that improve her immune system, but we don't want to give her some things that might ultimately cause more collagen production. That's what they have. They call scleroderma the skin disease that causes the skin to look so great. They look absolutely healthy on the outside, but of course on the inside they're having a buildup of collagen on their vital organs. So what we don't want to do is give them peptides that might increase their collagen production. So again, we might look at the B vitamins, methylated Bs, we might look at beta glucan, but we have to do this very carefully because it's really important to be right in the middle and not overproduce her collagen, because that is our problem.
What causes that?
It's an autoimmune. You can be born with it. It can be an acquired. We heard people didn't even know about this for the longest time. I actually had a good friend of mine who passed away in her 50s from it on the internal. It was on lungs. She had a lot of lung scarring. And that's the problem. So you want to look at the symptoms and you want to go somewhere. And if you really test positive for the markers of scleroderma, you want to get to somebody who really understands the disease. And there are not many people who do, not many physicians who do, John.
Okay, we are going to talk about patient with post-Lyme.
Post-Lyme, that's more of that is the young man we just spoke about. He's a mess. The Lyme disease, of course, we've worked on the viruses. We've managed to bring his viral count where we want it. But again, I think he has mast cell activation, and it's very happening. He's having the mental issues associated with this, the brain fog, the concentration problems. He's also having gastrointestinal problems, dermatological problems in that he has the pale skin, the rashes, that kind of thing, respiratory, and cardiovascular. That's why the symptoms were why I said I think we ought to look at mast cell activation. It wasn't just a simple, not that there's such a thing as a simple post-Lyme, because there's a lot of overlap. But in this case, we had to look at what was going on beyond that, and I think we did. And again, I'm going to tell you something that's interesting. I believe that using the natural substance, the antivirals, the natural antivirals like the lysine, the melaleurin, etc., as well as boosting up his immune system, I think is ultimately going to be the way this guy has to go. But I think he's going to end up being a lifer. That's the sad.
I was just going to say, most of the people you've had with post-Lyme end up becoming lifers.
Yeah, because they have so many other triggers, and that's the problem. Once this thing gets involved, and once your immune system is in overdrive, man, you're in trouble. Period. End of story.
You had a lot of patients from out of town.
Again, yes. And that's very interesting because they came in and they're still here. They're going to be with me till Wednesday of this week. I'm doing a protocol that involves we're looking at his serotonin levels. This guy has he had clinical depression. I mean, severe anxiety. He was on a myriad of neuro medications and psych medications. And again, we're saying he does need some, but which ones? So what did we do? I'm waiting for the test results. We did a genetic test. We did a swab test, sent that out early in the week when he came to us on Tuesday. I probably will have the test results late tomorrow. And I'm looking for his genetic makeup and to see what conventional drugs he should be on. Because apparently the antidepressants and the anti-anxieties that they have him on isn't working. Now, get that? In other words, his traditional treatment isn't helping him. He's seeing a psychiatrist. I called our consulting psychiatrist in Philly. He said, "You're doing the right thing. Let's get the particular genetic makeup, and we can get an antidepressant and maybe have one and another one rating for him and make sure that he gets on this in the proper dosing." That's the other thing. If you're not at the right level of your antidepressant, you might as well forget about it. It's like pouring a glass of water in the ocean.
Yeah.
You can't do it. So these are the things we do at our facility, and that's why it takes some time, and that's why they're staying another week. You see.
You have a variety of complicated cases.
This past couple weeks has been, that's why Dr. Molly's been running ragged with Dr. Pat. We've been running ragged on these conditions, and it's the kind of thing that we have to tread very carefully because, again, you notice I'm not telling people to get off their conventional drugs. I'm saying let's augment these conventional drugs with what we believe might help somebody, like with this depression. Now, I spoke to him yesterday, and he said, you know what? I'm feeling somewhat better. I said, can you imagine if we get you on the right antidepressant, how much better you'll feel?
Yes.
I'm anxiously awaiting those results because I do believe it's a question of giving him the right neuropeptides, the right neuro medications, and also putting him again on repurposed medication like the low dose of LDN to help someone like him. And I think you're going to see a tremendous difference in this young man.
So you're going to give him more of what?
I'm going to probably give him more of the kinds of things, the amino acids that are neuro in nature, neuro amino acids like the phosphatidylcholine, like the NAD, and these are all delivered through the hydration. And again, I'm going to reiterate the fact that he said he's feeling better with those. I'm saying imagine how much better he'll feel when we find the right true pharmaceuticals he needs to lick this thing. He's going to be infinitely better. And I think even his nurse practitioner back at where he comes from will say this is a great move because I'm going to send her the results to show these are the antidepressants that should work for him. There seems to be no medical contraindication. Let's put him on a dose of this and let's get him to the proper dosing. And then he'll come back for maintenance.
We are coming up on our final break of the morning, which means you still have time to call in if you have a question or a comment for Dr. Molly or a medical challenge you want to run by her. 855-839-1210 is our number here in the studio, 855-839-1210. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. And I'm your host, John DeMasi. We are both, Dr. Molly and I, are returning with more of today's Health Watch after these words. We are back here on Health Watch, and again, operators are standing by at Innovative Medical Associates. And the number, 856-489-0505. That's 856-489-0505. And if you want to check out the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. A lot of good information on that. And don't forget, if you miss any of today's show, or if you heard it and you want to hear it again, no problem. We're here this afternoon, the Health Watch replay from 4 until 5, right here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, and we're ready to talk to you at 855-839-1210 is our number here. And we're going to talk about this Parkinson's patient that you have.
So I have this wonderful woman. She's in her late 60s. She came to me. She's in a wheelchair, and she has these uncontrollable tremors. And although she hasn't been diagnosed with full-blown Parkinson's at this point, her tremors are pretty bad, essential tremors of some kind. But anyway, so of course we have a scale for people. We want to know from 1 to 10, 10 being the worst in terms of your quality of life issues. And, 1 being the best. Well, when she started with us, she wrote 10 plus. Now, this is her 3rd week. This week, she came in. We had a very nice discussion. And again, we're using things like the NAD. We're using neuroamino acids. We're using vitamin C. We're using repurposed drugs, as well as low-dose pharmaceuticals. And some particular things that help spasms and things like that are homeopathic. All this is done through hydration. She actually went down to a 6. So she said, yes, I'm having some improvement. And she gave me a little smile. And I said, really? So show me your scale. What's your scale? If 10, you came in 10 plus. She said, well, I'm to a 6 now, Dr. Molly and Dr. Pat. And we looked at each other and we said, okay, so tell us what's improved. She said, well, first of all, I feel more optimistic. I mean, she talks. She's a very intelligent woman. And by the way, she came to us right after a funeral for one of her dear friends who passed away. She had stopped at the church first and came to us after. And she said, I'm still feeling more optimistic than I did a couple of weeks ago about my condition. Well, I looked at Pat and I said, I think that's a win. That's a win.
Sure
that's
is.
a win. And her husband said, absolutely, that's a win. And it's interesting because people who have these types of conditions may not always recognize when they have some improvement because they are still having some tremors. But she said her tremors seem to have lessened. I thought that's a win.
Yes, no question.
Then here we are. And how is this being done? Of course it's being done with the hydration using these particular things I referenced in the beginning of the segment here. So again, you have to realize this is a complex case. We're not going to cure Parkinson's. We want to improve her quality of life. And her quality of life might not be getting out of that wheelchair. It might just be improving her outlook. It may be also improving how the length of time on the tremors and reducing the amount of tremors. That might be enough for her. We're not sure. She's also working with our physical therapy doctor. And I have to tell you, she's making strides in getting up and out of the wheelchair. And she said it. She said, it's hard work to do it, but I've been doing it at home. Hello, that's what we need.
So you've really made improvements in this person's life.
Right on. Now, I have another patient who has ALS, as you know. She just was able to get a communicator. Okay, this is an electronic device that's put on her wheelchair.
Yes.
She's in really tremendous, she's got a tremendous case that's been going on for a long time. And she's had all kinds of treatments, both conventional as well as a whole lot of homeopathic. So this week I said to her, Elise, can you tell me, now that she has the communicator, can you tell me what's going on? She said, I have tremendous pain. Now she's doing this with the communicator. By the way, the communicator only reads eye movements. Isn't that unbelievable?
Yeah.
This is like unbelievable stuff. So the eye movement said she had pain, and I said, where? She said, in the muscles, which we'd expect with that condition.
Yes.
So what did that do? It made me go back to the homeopathics as well as the B vitamins, as well as the amino acids. And you use different amino acids for different neurodegenerative diseases. It's not a one-size-fits-all. Right? Because various parts of the brain are affected, and they're different between the Parkinson's and someone like Elise and the ALS. So we're looking at that, and I was able to give her some things that work on the spasms in her muscles. I'm looking forward to talking to her this week coming up.
And you'll keep us.
Of course I will. Of course I will. This is a tough case.
Yeah, that is one of your toughest cases.
Yeah.
I should say. Let's talk about Sandy.
Sandy's been gone for 2 weeks because she's down at the shore. Now, Sandy is our patient who has a tremendous amount of rheumatoid problems. And I'm talking about you can see her fingers are all bent. I mean, she really has a tremendously hard time walking around. And again, she walks with a cane. But what I love about Sandy is she never gives up. So she's been spending 2 weeks at the shore. I said, how you doing? She said, okay. I'm not running a marathon, but I'm doing okay. But I will happily be back in your chair next week. I said, well, all right, Sandy, is there anything else we can do? She said, you can get rid of this dastardly thing. I said, I wish I could. She said, yeah, I know. If I can't say the name. If a very large facility couldn't get rid of it, can you? I said, well, keep going back to that facility. She said, I know, and I do.
So you've got a variety of stories here.
Absolutely. And then there's my cancer patients that I feel like we're doing pretty well with. Again, 2 of my patients from North Jersey came back with their MRI and PET scans. Both had slight improvement. One of my patients I referred to an interventional radiologist for her particular cancer. She had nasal cancer, which is terrible. They were able to remove a lot of it, but they still had some things there. I sent her to an interventional radiologist to try to remove the smaller tumors that are still there because they couldn't get to the margins. The bleed is very bad, in that cat.
Yeah.
But she also got a very good report that there's no new lesions. That's a win as far as I'm concerned. And again, it was done both conventionally as well as utilizing our particular nutraceuticals, anti-cancer stuff, including particular doses of vitamin C and other immune enhancers. So there's a myriad of stuff going on there, John.
You've always believed in getting the surgery or getting whatever necessary.
Oh, my God, get it out. As
get it out.
My good friend, the oncologist, says, get it out. And I believe in that. And if you have to do it, you have to do it. You know that, John, for you.
Yeah.
Forget about me.
Right.
I said, get it out. And then we can move on, because we can always enhance your quality of life. That can buy you time, right? Buy you time, because there are new drugs on the horizon every day. There are new categories, immune enhancers. There are new techniques with the interventional radiology, right?
Yes.
That we didn't have 20 years ago. So guess what? You want to have the time. So let's get out the dastardly thing that starts the whole thing.
And with that, we are going to put the wraps on another edition of Health Watch. Don't forget, operators standing by at Innovative Medical Associates, 856-489-0505. And I always tell you, they'll be there well after we leave you at 9 o'clock this morning. 856-489-0505 is the number. Check out the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, we have our Health Watch replay this afternoon from 4 until 5. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, and our nursing staff, Barbara, Lana, Donna, and Vicky, and of course there's Joanne and fabulous Fran, delightful Dee, and our medical assistant, Sandra. I'm your host, John DeMasi. Thank you for listening. We'll do it all over again next Sunday, Health Watch, 8 till 9, here on Talk Radio 1210 WPHD. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.